I was the head of sales for a joint venture between Aetna and Sutter. So we call them a payvider, where you bring payer and provider together to help lower the cost of care for members and for plan sponsors. So really working with different employer groups and working just to help find ways to make healthcare easier for members and also ensure that people actually know what benefits they have. And that's why we see so much overutilization in the United States of care that's been prescribed that's not needed. There's tests that aren't needed. There's a lot of waste that frankly happens. And then there's a lot of data where they think they're doing the right thing, but at the end of the day, they're not, right? We haven't changed the outcomes. And if you look at the data of just us as a country, we're getting sicker, right? And we're spending more money doing so. So it's broken and it's not working. We got to fix it.
One of the biggest reasons patients get readmitted to a hospital after they've been discharged is because the pill is filled at the pharmacy to its expected time to run out. And that's called medication adherence. Well, a lot of medications now are self-administered. So over time in running that program, we found that more and more pills are delivered through the pharmacy side rather than being administered through a physician, through the physician's office or through the hospital. And a lot of people now have to manage their own medication, when to take them, how to take them, any side effects that they're experiencing. All of that is now managed at home. So a lot of the story starts with how people who are given drugs for diabetes, for congestive heart failure, for heart disease, how they have to manage their own health care at home.
And then we stay in touch with the member to actually know what's happening, right? And a lot of that just isn't done today because we don't have that engagement in the home. We just assume, based off of a fill date, that the pill was counted and the pill was taken at home and the pill was taken, right? We don't actually know if it was done or not. So it's really fascinating when you start to unpack a lot of the data and think through ways. It was like a matrix where I was like doing math in my head, where I'm like looking at spreadsheets thinking, we don't have any of this data. Like, this is white space in my mind, where no one is actually capturing legitimate adherence data. We're just counting pills. Billions of dollars that are wasted by people just not taking their drugs when they need to. And there's, overutilization when they don't. There's ER visits, there's just things that are completely avoidable because people aren't doing what they're supposed to be doing. So how do we build an ecosystem and a care team virtually that can support people in the home?
So you have a family dynamic that includes not only the person who might need a device like HiDO, as some of your stories are going to show, members with dementia, members who have suffered strokes. As they progress, their families also have to manage their own stressors. And that's why the HiDO has been, in my opinion, such an important device, not just for the actual maintenance of good health care for someone trying to take care of themselves in the home, but also for reassurance for the family members that they don't have to be burdened with the complicated aspects of medication instructions, taking the medications, and then reporting or recording or somehow counting all those pills. Because one, the instructions are on the prescription bottle that then read by the HiDO device, and it's all programmed. So the person doesn't have to try to remember it because it's got the intelligence capability to remember those instructions. The person doesn't, if they forget, was I supposed to take it twice a day? Was I supposed to take it once a day? If they forget, they don't have to worry because with a device like HiDO, it's all built into its memory. And so the technology there is not just an assistive technology in terms of storing that information, it actually guides the patient in terms of the proper administration of that dosage at home or that prescription at home. And then it makes a record that the person actually took the medication, because If the person gets an alert that it's time to take their pills, they approach the machine. It recognizes the person through facial recognition, which is very important because you don't want the wrong person taking the wrong medication when a husband and wife go to the cabinet and forget which one's supposed to take which. So that's covered through a device like HiDO. It tells them which medications they're going to take. They push the button, it dispenses the medication, and then it records that the medication was actually taken.
And I think that's what's so exciting is the fact that we have that data now. And we have the ability, through a virtual platform, but also, through a video to show that someone's actually adherent. How much of an impact does this make, right, to total cost of care for a specific chronic condition or population? And I kind of just smile, right, because I think of the breadth and depth of savings and just efficiencies we get in the healthcare system, in the home. This isn't just about dollars and cents for health plans and plan sponsors. It's about how do we change patients' lives. Driving adherence, validating there's adherence, to a plan and to a health plan has just millions and billions of dollars of savings.